Ako po ay si Romeo Ramirez.
Ang pangalan ko po ay Raul Bilayo.
Ramon Danganan.
Ako po si Lenny Jalon.
Ako po si Remedios Amistoso.
Ako si Lucy Meman.
When you talk about clinical study, we deal on real subjects, on a study on the basis of either medical or substance, okay, and try to see the adverse effect. We got a 30 randomized study groups. Okay, this is a good study group because in research, at least 30 subjects are important for a good research paper.
Nag-start ako uminom ng OxRyd noong July. Pag minsan, yung nakakaubos ako ng 1.5 bottle. Yun lang talagang ininom ko. Ang pagbabago po ay yung pagtay ko, naging regular. Then, yung sakit ng dito ko sa may balakang, naalis.
Ngayon, nung pa-check up ko kay Dr. Lee, ako ng niresetahan ako ng gamot at saka yun nga po yung tubig na OxRyd. Medyo nawala-wala konti yung sakit ng paghihi ko, sir.
Ano naman po yung pakiramdam po natin? Ano po yung mga pagbabago po noon at saka yung ngayon po nung nagsimula po tayo uminom ng OxRyd?
Okay naman. Ay, yung problema ko kasi na yung pag-ihi. Nahirapan ako saka sa gabi. Ngayon, bumilis na ang pag-ihi ko. Gumanda na sa pagtulog. Okay ng konti. Hindi ko pa alam pag ano.
Bumaba yung cholesterol level ko. Tsaka yung sa blood sugar. Na-meet na yung normal.
As I was saying, patients were selected on the basis of how we will program the study, the uniform. Since we're talking about studying the OxRyd, which is a water solution, okay, and the efficacy of the water to its effect into the disease condition of the patient. So we selected and divided the patient into the more severe, the more acute ones, and patients with a combination of diseases like diabetes and arthritis, hypertensive or with prostate disease, patients who have been operated on with prostate and has concomitant hypertension and diabetes. The first and second month gave a good and a rousing finding, which is very, very positive. The findings range from improvement of urination, improvements of bowel movements. Some blood exams were lowered, especially the creatinine for patients who have renal failures or kidney problems. Blood sugars were lower for some patients who are diabetic. And there is a significant change for those patients who have bladder problems, bowel problems. Okay, so there's improvement in all those problem conditions.
Laking pinagbabago ng katawan ko talaga po. Dati, ang bigat ng timbang ko, 72. Ngayon, 73.7 na. Saka, yung aking dibdib nagbabara. Yung pag umakyat ako sa bahay namin, second floor, magal na ako. Pero nung simula nung gumamit ako, July, wala pa. Isang buwan, wala pa. August, September, yun na. Sabi ko, yun na, pinapawisan ako everyday. Tapos tumatayin na ako ng minsan 2 times. Pag kumain ako ng gulay, 2 times. Kaya sabi ko, naku, dabis pala itong OxRyd na ito. Dabis, napakaganda. Sabi ko, gano'n. Kaya, yung mga apo ko, naku, inaagawan na ako yung aking iniinom na OxRyd. Napako, yung 11 years old, kasi may hika yung apo ko. Hindi naman 11 years old. Tsaka isang anak ko na 33 years old. Ganun din. Steady yung BP ko, Dok, okay naman, 120/80. Naging normal. Dati ang normal na dugo ko, 140/90. Ngayon, 120/80. Malaking pinagbago po ng katawan ko po talaga. Salamat sa nag-imbento rito. Napakasalamat po. Salamat sa inimbento nilang tubig na yan.